Now making her way in to see the judges is Marie-Therese Marr from NUA Surgical. NUA Surgical has developed a patented surgical device to reduce maternal complications following caesarean delivery, the most common major surgery in the world. Their goal is to make C-sections a safer procedure and reduce preventable maternal deaths and post-operative complications.
Good morning. We live in a world where there are over 800 preventable maternal deaths every single day. And at NUA Surgical we plan to change this, and we're going to start by making caesarean section a safer surgery. C-sections have become the most common major surgery in the world, accounting for 30 million births every single year. And although it can be a life-saving procedure, it does bring with it increased risk of hemorrhage, infection and even death as opposed to a vaginal birth. On a daily basis, obstetricians are struggling with increased, more challenging surgeries due to poor surgical access and visualization. This is leading to longer, more complicated surgeries and ultimately has resulted in an 80% increased risk of either complications for the mother or the infant as opposed to a vaginal birth. Compounding this, the obesity epidemic is actually magnifying the risk of complications for the patient. Working alongside obstetricians, we have developed Stericision, which is the only self-retaining surgical retractor that has been specifically designed to address the unique challenges and dynamics of C-section surgery. This simple, ergonomically designed and patented retractor will provide fast, easy and safe retraction, which will enable the clinician to repair tissue, deliver the infant and, crucially, to identify bleeds. It will be provided as a single-use device, thereby we can guarantee its sterility and reduce the risk of infection. The market is ripe for disruption, given that all existing solutions have significant limitations because they're primarily centred around the use of hands and handheld metal retractors. This provides Stericision with a unique opportunity to become the gold standard for safe C-section delivery for all patients, regardless of their BMI. We have achieved significant milestones within R&D, having conducted 5 preclinical studies. We have a clear regulatory pathway and we have a very strong IP portfolio, including 1 granted US patent. NUA Surgical has achieved significant recognition by winning multiple awards on a global stage. This has led to strong partnerships having been developed with key US health systems. With over 30 million C-sections worldwide, we are entering a total addressable market of over €3 billion per annum. Our initial target market will be the United States, based on the clear regulatory and reimbursement pathway and high clinical demand. We have letters of intent from clinical champions who will provide access to major healthcare networks through post-market studies, and we have developed strong C-suite relationships with key industry players who recognise our novelty and our market opportunity, and any one of these have the potential to take Stericision global. And finally, to make all of this happen, we have a highly experienced team and a strong world-class group of advisors. Thank you very much for your time.
Really innovative stuff here. I suppose trying to understand time to market in terms of, from founding, what's your expectation in regard to that before you would see it's being used in an operating theatre? Okay, so I guess where we're at the moment in our development is that we have locked in our material selection and our device design. We would hope to be filing our 510K with the FDA within 18 to 20 months, and then you're talking about 5 to 6 months for FDA clearance. Immediately after that, we will begin our post-market clinical studies where we'll hire in a direct sales team and really focus on key sites where we can prove out the sales model. And then after that, growth will be through key US labour and delivery distributors that can bring the device throughout the United States.
Thank you. The price point seemed remarkably low to me, especially for the US market. So I'm wondering how you've determined price and how you determine price.
Okay, well, we're looking at an ASP of between $200 to $300, which has been really positively accepted, I guess, by many of the key opinion leaders and clinical champions that we've spoken with in the United States. That's competitively priced, but it also allows them to have local approval within a departmental level within the obstetrics departments. It also falls within the existing DRG code for childbirth, which is really standard for the surgical kit for caesarean section.